discussing a research article about so-called frank autism vis-a-vis those autistic children who are not immediately obvious as autistic after a 5-minute assessment. So the frank presentation of ASD basically is an unmistakable or immediate behavioural presentation, and about 40% of the ASD population, 40%, so slightly less than half, have a frank presentation. So, yeah, immediate behavioural, where like someone is like, yeah, that person's autistic, like they're just giving off signals. Like I said, it's funny, that person that knew me as a kid, from like toddlerhood up until my early teens, said to my dad that she wasn't surprised and that she just assumed I was. So I was clearly giving off some signals that she picked up when I was a kid, and she wasn't even an expert, she was just a random layperson. So as I say, I think I probably was quite frank, at least when I was a kid, but possibly not so much now, because I've learned how to kind of hide my traits, although I still think that probably people will pick it up if they spend any time with me, because just will, because I'm pretty obvious autistic, yeah. So I think people would pick up if they spent any amount of time with me. But I think certainly, I think probably like, at least on if people don't spend much time with me and I'm like really, really, really trying to kind of act normal, and I'm like putting on my best front, and I could do that quite well because I could just copy quite well. People may not pick it up, but I still reckon they'll notice something a bit odd about me, because I'm not quite, I just get, because, they're bound to. I mean, hell man, I suck at eye contact. And also I don't come across as my age as well, so I think people will kind of notice things, but they might not necessarily pin it down to autism unless they're very familiar with it. But as I say, when I was a kid, I think it was definitely a lot more obvious than what it is now. So even though I got quite a late diagnosis, but that was again down to other things, just wrong generation and so on. So apparently ASD is immediately evident in only a subset of toddlers with the diagnosis. And the diagnosis often involves some degree of uncertainty. Only 60% of diagnoses made by highly qualified clinicians were made with complete certainty, and that clinicians were more certain when identifying autism than ruling it out. So, in other words, again, those very frank, kind of obvious manifestations, clinicians were very, very confident in their diagnosis with those people. They were very, very confident at ruling in autism, but they were not so confident about ruling it out. When there was like a degree of ambiguity, they were not so confident. Children presenting with moderate compared to high or low levels of observable ASD symptoms, older children, and those with higher IQ and adaptive behaviour abilities were all diagnosed with lower confidence in quite a few studies, although in this particular study that was less obvious. In this particular study, that didn't seem to be the case so much, which suggests that actually experienced clinicians do have quite a high degree of ability to kind of pick out autism, even in older children and those with a higher IQ, this study suggested, which was a bit different to other studies. Both very young and older children tend to be more challenging to diagnose. In the present study, clinicians with expertise in diagnosing autism spent 5 minutes observing a toddler presenting for ASD evaluation. After this brief observation, they documented their initial diagnostic impression, ASD or not ASD, and the confidence in this impression before completing the full evaluation. The clinician's initial impressions matched the final diagnosis in a majority of cases, so around 81%. For toddlers for whom clinicians' initial impression was ASD, the initial impression matched the final diagnosis 92% of the time. But for toddlers for whom the initial impression was non-ASD, the initial impression matched the final diagnosis 76% of the time. So yeah, in other words, for those cases where, for some cases where the clinician was like, no, that person doesn't have ASD, we can't see it, it's not there, in that initial impression, there was quite a high degree of false negatives. So quite a number of these children did later go on to get diagnosed autistic once they'd had a full evaluation, which again suggests that initial impressions are not always reliable. They're reliable at they tend to be reliable at identifying autism when the behaviour is clearly there. They're not so reliable at identifying more like hidden cases where the behaviour isn't necessarily immediately there. Yeah, the sensitivity of detecting ASD within the first 5 minutes was moderately low. Sensitivity of detecting ASD within the first 5 minutes was moderately low, defined as indicating ASD impression when a child had a final ASD diagnosis. So that's all final ASD cases, in other words. However, the specificity, that's to say detecting non-ASD cases in the first 5 minutes, in other words, true negatives, or all final non-ASD cases, was high. Although the overall match between initial impression and final diagnosis was high, there was a statistically significant change between the proportion of initial impressions of ASD and the final diagnosis of ASD. Clinicians overall had higher confidence for the non-ASD final diagnosis group compared to the ASD group. And this supports the hypothesis that very brief observations, even by experts, are insufficient for screening when conducted in the absence of diagnostic evaluation would lead to a high false negative weight. The sensitivity of initial impression was low, 64%, but in contrast, the specificity of the initial impression was high, indicating a low false positive rate, and suggesting that in some children, autism is readily observable by experts. When a clinician did not initially think that a toddler had ASD, there is still a 24% chance that that toddler would ultimately be diagnosed with ASD after evaluation. Clinicians cannot rely on brief behavioural observations alone to rule out ASD. So this shows that caregiver concerns, paediatrician concerns, and positive developmental screeners must be followed up, even if experienced clinician does not have impression that a child is autistic after a brief observation. 92% of children initially thought to have ASD met the criteria for diagnosis after a complete evaluation in this study. But brief observations are not sufficient to rule out autism. It may well be that some children who show social interest during the first several minutes of a clinical interaction, such as offering or responding to a greeting or making eye contact, may not sustain high level of social engagement throughout the evaluation. Critical social interaction skills may need to be specifically probed, for example joint attention, and observed over a longer time frame, initiating or sustaining social interactions with others, or elicited in a context of competing non-social demands for weaknesses to become evident. The frank or classic behavioural presentation is specific to autism and is often quickly ascertained, so 40% of autistics are frank or classic in presentation. But what may be frank to experienced clinician may not be obvious to those with limited experience. So again, someone might be frank to someone who's very experienced, but they might not necessarily be frank to, say, a lay person who doesn't really know much about autism, although that person will still be picking up on other things probably, and they'll still probably notice something a bit odd. They just might not necessarily put it down to autism. So there are some limitations with this study. The initial impressions and final diagnosis are made by the same clinician. So there is such a thing called confirmation bias. And which suggests it can be hard to change one's first impression. Thus, the relatively high match between initial and final impressions may reflect the clinician's reluctance to reject an initial impression. So, in other words, they're biased by their very first impressions, and they then stick to that even if the evidence changes, because it's like they seek that which confirms their initial impression and discard everything else. That can happen. It's kind of unconscious, psychological kind of phenomenon. So that can occur. And this is likely true to some extent, the study says, but the data suggests clinicians did revise their initial impressions in a substantial minority of cases. So, cases where the clinician did not think the person had autism in the first 5 minutes, but then later on, when they carried out a full assessment, the evidence came to light that this person actually was autistic, and then the clinician changed their mind. So, this study suggests that this did actually happen in a minority, but a substantial minority of cases. Okay. So, thanks for watching. I'm going to have to come back to this because I have got quite a lot more I want to say about this. But do let me know what you think, and thanks for watching.